So Julie, you're here today after your surgery that I performed on you, about almost 5 weeks?
5 weeks tomorrow.
Right, tomorrow.
Yep.
And you had a condition called plantar fasciitis, and
Yes.
most people know it as a heel spur. And basically, you were pretty miserable when you first came in to see me, right?
Yes, I was very miserable.
And how long have you had it, like, altogether, from the first time you remember having this?
It was the latter part of last year when it started, and then it would ease up, and then it would get worse, and then it would go away, and it would depend on how much, activity I had. But then it got to the point where it didn't matter what the activity was. It was a constant pain.
Right, and like we tried everything on
We did 2
surgical.
cortisone shots, didn't touch it. I have the orthotics that I still wear,
Right.
and always will.
Right,
But I don't think anything would have,
right.
as far as I can tell, nothing would have helped.
Yeah, it's interesting. I told you that I always tried 3 cortisone shots through my 15 years of practice, but I went to Chicago, and there are a couple of really famous surgeons who also specialize in heel pain, because I kind of consider myself specializing in heel pain because I do a pretty decent amount of this surgery and Achilles tendon surgery. And they basically said that apparently there are 2 studies that they performed recently, and they said if 2 injections don't really do it,
Right, I remember you telling me
the
that.
chance of the 3rd one doing it is like non-existent.
Exactly, so
So,
why bother?
right, and it's a painful shot, I mean,
That's
heel
not fun.
injections are no fun. And like in somebody who comes in and they're like 80% better after 2 shots, I definitely do a 3rd shot, right?
Exactly.
But if
That's
somebody is
fine,
not
but if it's not,
right, if
no,
it's not
there's
better,
no
like
point.
why? So we did that toe pass ablation with, we still have to make a tiny hole in the plantar fascia to get the toe pass ablator in. But basically, it's a toe pass ablation procedure where we preserve the anatomical alignment of the foot,
Correct.
which is the new procedure.
Yes.
Everybody always comes into my office and says, I don't want any heel spur surgery, any plantar fasciitis surgery, because I've read everything online and I don't want it. And I think what I'm seeing is that people are confusing the old surgery with the new surgery, and of course there was a reason why the new surgery was invented, right?
Exactly. Yeah, I wouldn't want the old one either.
Right.
But
I
with
wouldn't
this,
either. I
I would
wouldn't either.
do it again
Right.
in a heartbeat. It was.
So was it successful in your?
Yes, it was.
So
Yes, it
5
was.
weeks later, would you do it again?
Yes.
Good.
I would have done it sooner if I could have. If I knew then what I know now, of course, we could have foregone cortisone and everything else and just done
Yeah,
this.
but who knows?
You don't know.
Right.
Exactly.
Who knows?
So I would always say you take it
Right.
a step at a time and
Right.
whatever works, but no, I would do this again, no problem.
And I think statistically they say that 90% of people get better without surgery. But there's still 10%, which means every 10th patient that walks into my
Exactly.
office doesn't.
Here I am.
But it's not like a lottery. I mean, 90% chance of non-surgical improvement is a pretty significant improvement.
Exactly.
So you would say definitely yes, if nothing else.
Definitely yes.
Good. Well, thank you so
Definitely
much
yes.
for sharing your
Well,
story with
thank
us.
you.